Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. Today we're going to talk a little bit about occupational therapy and how that kind of fits into your life if you're expecting or newly postpartum or postpartum, really, because that's what we are after you have a baby forever. So, Armi Grace, I'm going to go ahead and hand it over to you if you can start off with telling us a little bit about yourself and your business.
Sure. My name is Armi Grace Petersen. I go by Armi Grace. I'm an occupational therapist, which means I went to undergrad. I got my bachelor's in community health, and I went and got my master's in occupational therapy. I've primarily worked in the outpatient pediatric setting. I have my early intervention certificate, and I've kind of done that for the majority of my career. I am also a mom of 3 boys, and I had my own postpartum struggles. I had postpartum anxiety, postpartum depression, and it really catapulted me to starting my maternal health business, which is Motivated OT Mama, where I'm providing support to moms in pregnancy, postpartum, and motherhood and beyond. I think mothers, this moment, matrescence, right? Becoming a mother, it's a developmental milestone. And I think realizing that moms have a skill set to learn, and how can it be taught, and how can we support and educate moms so that they're empowered and feel confident in this space.
I love all that because normally when you think about occupational therapy, my background is special ed teaching. You kind of think of it in, at least for me, in like the classroom setting or being something more that applies to just the little ones. So that said, let's just start off with the basics. What is occupational therapy and how does it support individuals both during pregnancy and during the postpartum into motherhood stage?
Yeah, of course. So occupational therapy, the root word is occupation, right? What's your job? What is your role as a mom? We're a mother, we're a partner, we're a friend, we're ourselves. And so we are, trying to find the balance of these roles and being able to still engage in meaningful activities and managing these challenges as we transition into this new role. And so our occupations and roles are changing immensely during this time, right? And so in pregnancy, a lot of it is the education to prepare for the postpartum period, whether it's, body mechanics, making sure that we're moving our body correctly and safely to prevent injury during this time, or energy conservation. I mean, a lot of us are probably working up until we give birth, and, the fatigue or the pressure on our diaphragm, like managing those things. And in the pregnancy period, I'm really focusing on preparing a postpartum plan for families, because we focus a lot on mentally preparing for delivery, but what about the after part? What does that look like? And, in the postpartum phase, there's mental health issues that can arise. So educating my families on postpartum anxiety, postpartum depression, and other mental health things. Then in the postpartum period, it can range from, I've seen moms who have been home for the first 2 weeks, and we're getting into regular routines with them and how to manage that new transition to this role, and creating something that is functional when you're sleep deprived, and having clear communication with your partner as well. And later on in postpartum, I've seen moms in like the 3-month range where, they're kind of gotten into a good routine of things, but now they're finding that they're having a hard time bonding or developmentally understanding baby, and how can they be more confident and successful in that.
I mean, when you put it that way, like, yes, what is your role? Definitely makes you kind of think a little bit more about like your role as an OT.
Yeah.
So with everything that you said, how does OT, occupational therapy, help pregnant women manage with the physical discomfort and prepare for these demands that come into play during motherhood and these, expectations essentially?
Yeah. And I think the first thing is really bringing mom's awareness to her body. I think in the day-to-day life, I think we're just moving at a pace that we don't have those moments of pause and really to reflect of where our body is at. And so I really take my moms into a journey where we're being more insightful of our movements. Like, okay, when you wake up in the morning, how does your body feel? Let's check in with your body, right? And when you're getting in and out of bed, you can't just get up, right? You have to roll to your side, sit up, and stand up. And also like preparing the pelvic floor with some deep breathing, making sure that every time we move, we're exhaling, so that we're not clenching and holding our body there. But also too in the pregnancy stage, like we can talk about the sensory system, like smells, right? There are things that I could smell that would make me so nauseous, and thinking of, are there like essential oils or something in your toolbox that you can use. I love like a good TheraPressure ring. It's just a ring that goes around your finger and it gives you some deep pressure, and it's really regulating and can be grounding for moms too.
Oh, some really great ideas.
Yeah.
So just even thinking about the physical part. So normally, again, when you think of something that's related to the physical part, and when it comes to motherhood, I and probably a lot of other moms automatically think like pelvic floor PT. Mm-hmm. For those of us that are aware of what that is, because I know it's not very common. So that said, how or in what ways can OT assist with a postpartum mom with recovering after childbirth, both not only like the physical part, but also in that mental support?
Yeah. I mean, I think that when it comes to pelvic health, like physical therapists definitely have a role in that, and they have a different lens. And I know occupational therapists who specialize in pelvic therapy as well. And unique to the OT lens, we look at our patients or our clients like holistically, not just their physical, mental, and social, but what are their environments? What are they routines? Like what is their day to day? And thinking about, your pelvic floor, what does that impact? That's sexual function. And actually, believe it or not, in occupational therapy, we have basically like a guide, right, of all the things that we can address. On there, I kid you not, sexual function, like sexual activity is part of our occupational therapy scope. And so, I mean, there is more specialized training, but it's just a unique thing about OT. Like we are really trained to be able to address that. And it's even in our documentation. And so looking at sex as part of it, bowel and bladder, right? And so those are part of activities of daily living. So not just can you go to the bathroom or are you having sex, but what are the healthy routines and habits that you have? And is there compensations you're making that's resulting in, or sexual pleasure or, pelvic dysfunction? And how can we address that outside of like the muscle group? But maybe you do like some mindfulness, or maybe you do some self-reflection. Maybe you read a book or watch a video to get you in the mental space to be ready to do that. And a piece of more the sexual part is communication with your partner, right? Like there's also the mental piece to it. With clear communication that plays a role, and having a dialogue or practicing scripts, like that's something OTs can also help with.
Kind of like an all-around thing.
Yeah.
It's a menu of items.
It is. And that's like my love-hate relationship with occupational therapy, is that it's so broad and it truly is client-centered. So it's really whatever is difficult or meaningful to my client, that's what I'm going to focus on. That's what's important to you. And I have to pull the tools out of my toolbox to help you be successful. And at the end of the day, my job is to educate my parents and families and moms so that they don't need me anymore. Like I want to be out of a job. Like that is our end goal as an occupational therapist.
We've been talking a lot about like the postpartum into motherhood and kind of more general. Let's kind of focus a little bit more on the newborn piece. So your role as an OT, how does that help new moms with adapting with the physical and emotional changes and demands that occur during this newborn stage?
Yeah, no, it's a lot, right? And you're meeting not only a new baby, but you're meeting a new version of yourself. And that within itself is a whole nother, learning curve. And I really like to look at that first year of life and even beyond. It's hard to separate mom and baby. I view them as a dyad. And so thinking about, what is mom doing well? What could she still need support in? What is baby doing well? What is baby needing support in? And Moms will come to me because they see some difficulties with development with their child, right? Like, for example, they're having a hard time with tummy time. They might see some torticollis, they have a side preference or difficulty with starting solids. And so in traditional OT, you would go to the clinic, right? You would get an evaluation and then you would get a treatment plan. And I would see patients sometimes for 9 months, maybe a year, if not more. But with my approach with OT, I do in-home services and I really take the time to assess their environment. I also take the time to address parents' mental health and kind of like what their perception is of the scale. Like, is there a part of mom that, is really worried about tummy time or solids, like the fear of choking or not being able to recognize choking versus gagging, and starting there and getting parents in the mindset to navigate these developmental things as their child grows and have confidence with it. And I mean, I only see my patients for like an hour or so. So I can only do so much work in an hour. It's really educating parents and having them comfortable to do the exercises and the activities so that long term they're able to carry over the work that I do with them and really see those changes in their little ones.
Introducing the Mama Making Podcast, your go-to space for honest and empowering conversations about motherhood, pregnancy, and everything in between. Hosted by Jessica, a passionate mom navigating her own journey through motherhood, we deep dive into the highs and lows we all face as moms. Each Tuesday, tune in for candid chats with experts and moms, sharing practical parenting tips, new mom advice, and real-life stories that help you thrive. Whether you're expecting, dealing with postpartum challenges, or balancing life as a working mom, this podcast offers the community and support you need. Join us for discussions on self-care, mental health after childbirth, and the beautiful mess that is modern motherhood.
Love that. But yeah, kind of how you mentioned with a lot of like the OT, for me, it automatically kind of makes me think of the school setting and the little ones and how they're more so the ones that get the support. So totally different perspective for me that I never considered.
Yeah. And I mean, occupational therapist in maternal health is definitely like a very emerging field. Not just in, I think maternal health and OT has really been like pelvic floor therapy, sexual dysfunction, but never really looking at like the mom and breaking down those skill sets to see its impact on baby's development. And research shows, when parents have good mental health, like the trajectory of development is so much better for baby. And I don't think we're taking the time to really ask moms, like, how are you doing? Like, we have one postpartum visit. Maybe they do the EDPS, like, or the PHQ-9, which are, the mental health screeners. But are there answers and solutions provided after the screener? I mean, most moms tell me they're too scared to tell the truth because what if their baby gets taken away? It's hard being a mom. And even me as an occupational therapist, like, knowing what I know about mental health from my background and training and working with families pre-kids, like, I had a hard time. So how is somebody who has training and has background who also is having a hard time? I can't imagine somebody who's just a typical layperson having a hard time and not having resources and not knowing where to go.
Yeah, I think that's the big piece is like not knowing where to go and not knowing how to even begin to get that support, right? And then there's the financial piece where everyone's like, well, maybe my insurance doesn't cover it or I can't pay out of pocket. But, there's definitely resources out there.
Yeah.
So my next question, I want to now focus a little bit more on the postpartum challenges that we tend to have as moms. So with OT, how can you help with supporting moms through things such as breastfeeding, pelvic floor recovery, and that mental health piece that we were just kind of talking about?
So occupational therapists, we have training in oral motor skills. I've taken several classes, continuing education classes. I'm on the fence about getting my lactation certificate, but I identify as like a lactation savvy or lactation informed occupational therapist. So I am able to work on breastfeeding with parents or with my moms and their families. You can assess the oral motor skills, the sensory aspect of it, even the motor planning piece of, is baby able to turn their head? Is baby strong enough to, keep their body in that position? And then on the flip side, looking at how's mom's body mechanics? Are we hunched over all the time? Are we like stressed when we're pumping too? Because that can impact our supply when our output. And then in addition to breastfeeding, like I also can help support with bottle feeding. And I mean, of course, I have the bottles that I do like, but every baby's mouth is different. So I don't recommend like just one bottle. I think being able to try things out. I have a bottle library actually, and I let the parents like test out the bottles before they go and buy them so that they can kind of practice. And, I break down like you want to see the lips phalange, you need to make sure we have a good seal. I also do work on like pre and post, like tongue tie releases, supporting families to get ready for procedures if they opt for it, and help with post-op too. So that's like the breastfeeding, feeding side. And then I think we talked about the next one was like pelvic floor therapy and the pelvic floor recovery. I think we had mentioned earlier, like getting in good habits and routines. As an OT, I can do external and internal. I have some training in it, but I'm not super specialized in internal pelvic floor therapy. But I do work on some diaphragmatic breathing, just making sure that we are not clenching and watching our body mechanics, having a routine when it comes to going to the bathroom. I think as moms and even as professionals, just in case peeing, like we're like, okay, I don't know the next time I'm going to go to the bathroom. Like I'm just going to go right now. But that also isn't training our body to be best, right? I just took a course where I forget the statistics, but our bladder can hold up so much liquid, but we only start
Unless
getting
you're
like
pregnant.
Yes, that too. But I think it's maybe like 400 to 500 milligrams, but your body can tell you that you need to go when you're like at 100. So it's like a lower threshold than the max. And so having to retrain your mind and your body to be like, okay, yes, your body's telling you that you need to go, but maybe you can make it a little longer. Is it like this, then you kind of have to look at like, is it stress? Like what else is going on? And there's of course the deeper side of, is there trauma related to, the bathroom, the pelvic floor situation? And those are things I would want to be mindful of as well. And then I forgot what the last one was. It was breastfeeding, pelvic floor recovery,
Mental
and
health.
mental health. I administer 2 screenings to my moms, the Edinburgh postnatal depression scale and the PHQ-9, the parent health questionnaire. And that just kind of gives me some information in terms of where they fall. And I always preface to moms like, this just gives me more information to support you. I'm not judging you by any means. And I often tell my story of how I had postpartum anxiety and postpartum depression with my kids. And it was a really dark place for me. So from not only a professional piece, but from a personal place, I am trying to really decrease that stigma and that isolation and loneliness that comes with it. So that's usually the starting point, is identifying like where mom is at and, trying to add in little bits of self-care, or if it's to a point where she would benefit from medication or more formal like mental health support, I always refer out, because I think moms need a village. I'm not a one, I don't like to market myself as a one-stop shop. I think moms also need a community and village, even though nowadays it's more of a provider versus like true friends. But that mental health piece is really important. I run community play groups for moms, who are postpartum. Baby doesn't necessarily have something wrong with them, but, they're looking for a safe space to ask questions. And I always get the moms that are like, wow, like this was so nice just to get to talk to other moms. Or I had some mom the other day tell me that she met a mom at my group and they like connected and now they're best friends and they hang out all the time. And I'm like, I cried, because that was exactly one of the things that I wanted to come out of, the group and the support too.
I love that. And I really love the fact that you kind of essentially state that you're more of like the first stop before referring out if there are more concerns. So for something such as like the pelvic floor, if it is something that you can't handle or care, or I'm using the wrong wording, but something that you can't fully support with your time, because that is a lot to do if you're doing nursing and mental health and pelvic floor, to then be able to recommend somebody that specializes and that allows them to get more of that very specified or specific support for those different concerns that they have.
Yeah, it's so important. And even too, like with the feeding, like I work with local IBCLCs because there's a point where my OT scope isn't just the only scope that's needed. And, I think everybody has their specialty, and they're in their training and in their space for a reason. So I really hone in on networking and connecting with other professionals, because it's important for us to know what we each do, right? And so we know, like, if this is out of our scope, who can I ask? Who can I refer you to so that you do get the support you need? Because I know I can't provide that.
I love that. So that's going to lead me to my last and final question. Any other tips, suggestions, or recommendations that you have for anyone listening to this that, is either learning about OTs and how they can support moms, or that maybe is considering reaching out to one?
Yeah, the tagline of my business is motherhood is hard, but getting support shouldn't be. And I think we really need to normalize that the idea of asking for help is okay. It's not a sign of weakness. If anything, it's a sign of strength and resilience. And you are doing the best that you can with the information you know. And if you're taking the time to learn more, then you are doing more than like you're taking that active step. And I think too, in this stage of motherhood, and it took me time to learn this, maybe when my oldest was 4. So, it takes a while, I think, for you to get out of that bubble of being a new mom and caring for your baby and, the sense of martyrdom. And that's not what motherhood is about. It's understanding that you do need to take care of yourself. And self-care can mean so many different things to other people, but at the end of the day, self-care is doing something for you as a mom that helps you show up to be the mom that you want to be, or the partner, the wife, or the friend that you want to be. And if seeking out support from an occupational therapist is the right fit for you, then definitely go that route. I do offer 15-minute phone consultations because, again, not everybody knows what occupational therapy is. So I always welcome the conversation just to talk more about what is happening. And if I'm the right fit, then we go ahead and schedule an evaluation. And go from there. And after an evaluation, I determine like a treatment plan, frequency, whatnot. But if I'm not the right fit for the consultation, after the consultation, then I will refer them out to somebody who is the specialist. But I really am on a mission to just, expand the idea of occupational therapy in this maternal health, matrescent space, because it is so needed, to be in a space where you can ask somebody a question and not be embarrassed about it, and be educated and not be told, like I tell my clients this, what I'm telling you is all education. I will never tell you what to do. You will always know your baby best, and you have to trust like what your mom gut and what your mom heart can handle, right? But I think just being open to getting support and knowing that motherhood is a journey, and along the way you might need a little bit of help here and there, and that's totally okay too.
I love that. Well, thank you so much. I will have all of your information linked in the show notes if anyone is interested in reaching out to you. Thank you for taking time to connect and share your knowledge, especially in a topic that I didn't know anything about, other than, like I said, my exposure to being a special ed teacher.
Yeah. Well, thank you so much for having me. This was such a wonderful opportunity, and I loved connecting with you and just getting an opportunity to educate people about OT.
Thank you.
Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts, and give us a review if you like us.